Oh, hello there. It's story time. I just wanted to sit here. I have a question I'm going to answer, and it's been asked a lot of times. And I was gonna like sit and like show you, but then it was like snowing out and it's so beautiful. So I was like, let's just have me sit on the patient chair and do some story time. A question I get a lot is, tell me about your first day as a dental hygienist on the job, right? Like people ask me that, like how did it go? Give me any tips, like what happened? Like what should I expect for my first day? I get this question a lot. I haven't answered it because it was very, I don't want to say, I felt very prepared. I knew I was like a good clinician. I knew like, I was very nervous about my speed because I know I was very like slower at the beginning, but it's fine. You get through it like anything, right? You're always like slower when you first start things and then you get fast because you get more like proficient. My best words of wisdom is you have it. You got this. Just practice makes perfect. Story time though, I'm gonna try and hopefully give some tips too. I clearly remember, like, there are some things you need to know because I didn't know. Every office is different, obviously. But my office, so for my first patient ever was a new patient, which is, I think, kind of good because then they have like no expectation, like who you are. You know, it's always like comparing, like, oh, it's the new girl. I usually see the other. So I liked having a new patient. I thought that was grand. That was great. However, I remember being really stressed about like, did they fill out their medical history form yet? How do I know when they're ready? Like, that's the first question you should ask is, how do you know that they're here? Like, I know that sounds silly, but like some offices have like the messenger system and they say patient is here, patient is ready. Like, figure out the front desk, figure out the communication on when to bring your patient back. Because I remember like sitting here being like, are they gonna tell me? I didn't like know what to do and I was nervous. I could have just went up there and said, like a normal confident person would, like, hey, let me know when my patient's ready. Either, you know, I could have asked the front desk, but instead I sat back here and like twiddled my thumb. I was so nervous. Like, how do I know when they're ready? It's so silly. You know, depending on what, you know, system you have, what program you have, like on the patient's name, it'll either turn like yellow, green, red, you know, if they're late. So ask that question. How do I know when the patient is ready? And do I just go up there and seat them? I was waiting till the patient forms were scanned in. I was just like waiting. I kept checking the smart doc, you know, and then they were like, we don't always scan them and you just have to come up and read them physically. I'm like, okay, because I've just been sitting here waiting like a weirdo. But listen, you're nervous, so you just do what you do. So that's my biggest thing. Figure out how you're bringing the patient back. That's number one. Another tip I have is, so my first patient ever was a new patient. My second patient ever was a returning patient, but it was a kid, which is really cool because, again, kids don't have too many expectations. Some do. Some will be like, I want Mallory. I don't know. Like, some people do know their hygienist. Some kids know their hygienist name, but this kid particularly did not. He didn't know what was going on, so that was helpful. He was just like, you know, hello, and I was like, hello. But I remember, like, I was really excited again that it was a kid because, I mean, you know, you have to talk to the parents. That's always the most, I think, for me, like, part that makes me anxious is talking to the parents. Not anymore. I'm just like 5 years ago when I first started. You know, confidence is key in this profession. I would say most professions in general, but especially in a medical profession. You are confident. That's the thing. You know what you're doing. You passed boards. You went to school. So don't think you're just nervous because it's a new office and a new environment. That's the only reason you're nervous. You know how to treat patients. So just pretend you're, you know, like don't be nervous about the environment. Another tip I would have, speaking of environment, is what I did before my first like time. Like, so I was an assistant here before, so I already knew where everything was. But my other office, I was not. I was just hired as a hygienist. So I went like a day before, like a week before, and I shadowed one of the hygienists. Like, yes, I'm already a hygienist, know what I'm doing, but it was really helpful to see like where she went for instruments and what drawers were where. My boss actually recommended it. She was like, do you want to come like a day and just come and see where everything is? And I was like, oh yeah, that's a good idea, because I'm not just walking in blind. I don't know how temps do it. I've never temped, but like to not know where everything is, where the gloves are, so you don't have to ask. Like if you need a new box of gloves, you already know where they are. You can just grab it yourself, you know? Anything that limits you, I'm like I avoid any conflict. I even like to avoid communication when necessary. That sounds crazy, but I just, if I could find the gloves myself, I'd rather find them than have to ask someone. I'd rather save my questions to my coworkers for like really important things. Do you know what I mean? Like I'd rather save my question to be like, what's this x-ray look like to you? You know, like a medical question instead of where are the gloves? I don't know. I just try to limit. That's so weird, but that is me. I don't like to I try to talk as minimal as possible. I don't like bothering anyone. I know you're not bothering them, but so that's my thing. It made me feel really comfortable at my other office, going and knowing and checking all the drawers, seeing where things are, seeing the, you know, the storage room, and seeing how they do the trays, so you're like, you know what's on the tray ahead of time. It's just that extra like early day of observing, that early day before you start your first day. If you can go in and just shadow observe, or just go out and check all the drawers and cabinets, that's very helpful. I'm sitting so weird. It's not comfortable anymore. I thought this was cute. I think that's all I got though. Just be confident. Know where things are. That helps you be confident, because the only thing you're not confident about is not knowing where things are and how the office flows, right? You know how to be a hygienist. You just need to figure out, oh, I know this last one, this one. Ask and understand how you need to ask the doctor for exams. I have polar opposites on how I ask for exams in my two offices, so I have to remember, right? Whatever the doctor prefers. Maybe the doctor doesn't care how you ask for exams. Then I'm someone who like listens to what the other hygienists do, so I'll just do what they do, so I know that they're comfortable with it. I just try to make everything as smooth. I don't want to stand out. I just, you know what I mean? Like, this is like a job you don't want to like be obnoxious, which is, that's funny because, you know, I'm like, you want it to just run smooth and you don't want anything to look wild. So here, we used to have a messaging system where we would message the doctor, ready for an exam. But now we've expanded, so it's like larger and you never know what room he's in. So we stand and we like make eye contact with the assistant, and then the assistant has like a code to tell the doctor that we're ready. And you know, whatever. So he knows which hygienist is ready. So I just stand there and like make eye contact. That's what I do here when I'm ready for an exam. But in my other office, we walk past and just go, ready, like ready for an exam, like she wants to hear it. So it just depends. Just ask what they want, how they want to be informed that you're ready for an exam. That's always good to know. And then also, piggybacking off that, also ask if you think this patient's about to be like an SRP or a different type of cleaning, ask how they want you to proceed with that. So here, where I just do the eye contact with the assistant, I don't want them to give the code ready for an exam if I think it's an SRP and I haven't started yet. You know what I mean? I want them to know I need him to come in to like, you know, collaborate with me and like talk about the gums before we start, you know what I mean? So I usually write like a little post-it and I put like SRP consult, you know, and I put the consult and I put the little post-it, so then when the assistant says the code to come in, she like changes the code. So she knows it's not just a regular exam, like please get in there fast, because she needs to know if she can proceed with SRP. You know what I mean? So figure that out too. And every doctor's different. Some like to really collab with you and talk about, you know, look at all the x-rays first and ask you about bleeding and everything from your assessment. And some doctors just want to come in and like do their own assessment. So it's, again, that's why that observing day is probably so helpful, because you can see, hopefully you'll run into one of those on your observing day and see how the hygienist handles it. Everyone's different. That's all I can say, and you'll just feel it out and just be yourself, be true to yourself. But my advice is to be smooth. Don't like go in there demanding things, unless of course it's like infection control, they're not wearing gloves. Like yes, demand proper infection control, but like if there's like an instrument you don't love too much, maybe don't like complain right away. You know, just try and be flexible. You'll learn how to use different instruments, and maybe you'll start loving an instrument you didn't know you loved, you know what I mean? But if there's something you know you need, you can bring your own too, you know what I mean? But it's always okay to ask. That was probably like very passive aggressive of me. Some people come in like saying, I need this to work. That's fine. I'm just not that type of person. If I need it and I don't have it and I'm not able to get it, I'll just bring my own, you know what I mean? But some people will ask, which is great. That's all your personality. I'm just super timid. So that's it. I hope you find your flow. I know you'll find your flow. It just takes getting used to. It's like driving a new car. You were used to working in your clinic at school, and now you're gonna drive this new car, your private practice or your corporate office. And if you do the shadowing thing, just one last tip, if you're shadowing and observing, try not to like zone out. I know that sounds silly, but like I shadowed so many times because I was pre-dental before. I thought I was gonna be a dentist this whole thing. You could watch, I have a video all about that, why I became a hygienist. I'll link that below. But I used to shadow so much, you had to for pre-dental club, and I found myself, I was just like zoning out. I wasn't really paying attention. Because right, it's very like the same stuff. So try to think about the different things if you're shadowing. Try to really, you know, ask questions after, like what happens if you feel it's an SRP? What do? You know, ask, you know, so that if it doesn't come up before, and just make sure you don't just zone out and watch them clean teeth. You're not there to like, well, maybe you want to see how they clean teeth, but you're not really watching the clinician for her technique at this point, or his technique at this point. You're there to like see how the office flows. So just keep that in mind when you're observing. Hope that helps. But hopefully this cute little, like, I don't know if you could see the snow that nicely, but hopefully there's birds out there. It's very cute. Hopefully this was like a fun little chit chat at the dentist in the dental chair. If you want to hear more about stuff like that, let me know in the comments below. These chit chats are kind of, I'm not sure, they're all over the place, but hopefully if you like them, let me know. And until next time, peace, love, and teeth.